In your health headlines, the late-night decisions making the difference between life and death. In a special report, Local Big 2's Kiara Powell goes behind the scenes at the highest level trauma center in the basin to see how doctors make the call.
Only minutes to spare. Life or death decisions.
Talk to me. What time did you take the cocaine?
And Medical Center Hospital sees more than its share. CDC reports show ERs across the U.S. average close to 130 million visits a year. Medical Center Hospital sees an average of about 50,000.
Typical night in the ER is that it's very atypical. You don't know what you're going to get.
I saw firsthand just how unpredictable an ER can be, spending about 5 hours there. Now, during that time, I saw everything from a urinary tract infection to a cocaine overdose. But there is one consistency: trauma. It's the one thing they say they count on seeing.
We go from it being completely quiet, which is a bad word in the ER, to several traumas coming in.
Registered nurse Teresa Hare tells me ER chaos can be affected by some unusual factors.
We are very superstitious. Very superstitious. You don't say quiet, you don't say slow. We check the moon, the date. We're very superstitious.
Whatever brings a trauma case into the ER, things like brain injuries, broken bones, and heart attacks. Hare says the first few minutes can be some of the most important for patient care, especially to a nurse.
We need to know every detail that they can possibly give us to give us a better scenario of what happened to our patient.
And from a doctor's perspective, Dr. Sudip Bose explained trauma is all about assessing which injury carries the highest priority.
We have to stabilize their airway, we have to make sure they're breathing okay, their blood pressure is okay, and then after that you get to the more minor ailments they have.
Because when you have to visit the ER, the nurses and doctors will be your lifeline.
Have you had any fevers or any signs of infection?
And it's that controlled chaos, and it's all for the benefit of the patient.
But at the end of the night, the ER must stay behind closed doors, giving some much-needed relief after the shift is over.
You can't take it home with you. You have to be able to find things to do to blank out the bad things that you see.
Kiara Powell, Local Big 2 News.